Good afternoon, everybody. I'm Jody Hanson. I'm the Director of Communications for Johnson County Government. Thanks for being with us this afternoon. I've got a couple of people with me to give some information and answer your questions. Dr. Sanmi Areola is here. He is the Director of Johnson County Department of Health and Environment. And Elizabeth Holzschuh is here, and she's the Director of Epidemiology. So I will let you both get started, and then we will take some questions.
Thank you, Jody. Dr. Areola with the Department of Health and Environment. I'll start off by just providing a couple of updates, and then Elizabeth would update us on our vaccination efforts with the Children Mercy and educators and other information. We are continuing to vaccinate in Tier 1. We had the last clinic for emergency services, law enforcement today. And at the end of today, we have vaccinated around 1,100 in that category. And we feel like we have captured most of those in that category. There could be a few that have not been vaccinated yet. And what we'll do is walk them into our other clinics. We set up those clinics in collaboration with those departments, understanding how many people need vaccinations, and then set up the clinics to accommodate that. So again, as we go through phase 2, Tier 1, is we are working through all of the different categories there, and some are smaller and it's easier to do them and check them off. Others will take us a while. Like I said, we are working with Children Mercy on vaccinating the 2 other groups there, which are educators K12, as well as childcare workers. Again, Elizabeth will provide an update. The biggest group in Tier 1, of course, is 65 plus. And we're continuing to vaccinate in that group. A lot of our health systems had several events last week where they are providing vaccine to our residents. And that's the idea. We are doing some as the Department of Health and Environment in our clinics, and they are doing some, and that's the goal, to attack this through multiple channels. I will say that this week, a lot of focus is on second doses. I was talking with Elizabeth earlier and looking at our numbers. Really combined between Moderna vaccine and Pfizer vaccine. We have over 7,000 persons this week that are due for their second doses. And the reason that happened is Moderna is 4 weeks, Pfizer is 3 weeks for the second dose. And we started off by giving out Moderna vaccines. But the past 3 weeks, what we have received have been largely Pfizer. And so this week, it's if you got your Moderna vaccine 4 weeks ago, you're due your second dose this week. If you got your Pfizer vaccine 3 weeks ago, you're due your second dose this week. And so when you add that to all these other first doses that we have to give out, it's turned out to be quite a lot. But we are doing all that we can to ensure that you get the second dose. And so I will say a couple of things. Number one, you have 42 days from the first dose to get your second dose. Actually, there are other parts of the world that really does extend that for even beyond 42 days. So if you miss, if you can't get it 1 or 2 days after that, a few days after that, there's nothing to panic about. There's no indication that affects the efficacy of the second dose. As a matter of fact, the data points to the fact that there's no impact and that you still get the boost that you would when you get the second dose. That's first thing to keep in mind. Second thing to keep in mind is we have your vaccine, we have your second dose, we have, whether it's Moderna or it's Pfizer, we have them. And what we are working on is scheduling that. In terms of our current schedule this week, which we are working hard to add more and to provide additional resources to, is that tomorrow's clinic at Oakland Fieldhouse is largely targeted towards those that are receiving that are due their Moderna vaccine. And so we do know that we've received quite a few messages from people wondering about where they can get their second dose from. Tomorrow is a good opportunity. Last time that I checked, there was still about 400 slots that are available. And so if you have not booked your Moderna vaccine for the second dose, you have opportunities tomorrow. Now, again, let me reiterate, I checked that a couple of hours ago, and those spots, they tend to fill very quickly. But last time I checked, there are some opportunities available tomorrow. On Wednesday and on Thursday, we have a mixture of second dose for Pfizer, as well as first dose, likely for our 80 plus population. So we've got about 800 spots for your second dose on each of those days. Again, last time I checked, seems like those are largely filled. Although, again, we're working on additional opportunities to increase opportunity for second doses this week. And we'll be providing further information about that tomorrow to you. But you will have additional opportunities to get your second dose this week. Now, here's where we need your help when it comes to our scheduling. We are really trying our best to follow the tiers and our approach to the vaccination. And we understand and absolutely appreciate the fact that everyone wants the vaccine. But because a lot of the information that we're using for booking those appointments are out there, and for me, it's easier for me to access the internet and to book an appointment, and doesn't come quite as easily to my 83-year-old mom. And so when we have spots that are booked, that are reserved for our 80 plus group, we ask that you help us, work with us to kind of respect the process, because when you don't, it disrupts what we are trying to do, and then it just adds to a little bit to our work, and of course the confusion. So a lot of the spots that we have reserved for 80 plus are taken over by people that are not really at that age group yet. And so as a matter of fact, about 700 of those spots were booked by people that are younger than 65. So I will say that I do understand that some might be healthcare workers, but if you are not, we continue to appeal to your sense of responsibility to the community to await your turn. Those spots are meant for those that are 80 plus. So if you would, of course, if you're a healthcare worker and you have the documentation to support that, that's absolutely okay. But those spots are meant for 80 plus. And if it's taken up by people that should wait for their turn, either later in phase 2 or phase 3 or 4 or 5, it's a little bit disruptive to what we are trying to do. Again, we appreciate your cooperation in that regard. So that's the key thing. Last thing is we're working on making the process for getting your second dose better streamlined. Clearly, we are working on how to minimize the need for booking a second appointment. And so we should be providing more information about that in the next couple of days. Elizabeth, you want to talk about educators, childcare, what we have done this week, how many we've vaccinated, and the plans moving forward?
Absolutely. Thank you, Dr. Areola. So last week we began our K12 public school vaccination clinics, and we vaccinated approximately 3,500 educators from our K12 public school districts, prioritizing SPED teachers and and beyond that, additional teachers and staff that the school districts had identified as highest priority. week, we have a little under 1,200 doses that we are allocating for private and parochial schools, as well as our childcare centers and homes. And so that vaccination clinic will be ongoing this Saturday, again, with a partnership with Children's Mercy Hospital here in Kansas. And as we move forward, as we understand what doses are coming our way and can be allocated to these school teachers and providers, we will be continuing to schedule additional clinics for these individuals. And again, for our educator and our daycare provider clinics, we are going through our schools and through our licensed childcare providers. So if you are a teacher or a childcare provider who maybe lives in Johnson County but does not work within one of our schools or centers here in Johnson County, please reach out to the jurisdiction in which you work to see if there are opportunities, and if there are not, as we move through the rest of Tier 1 Phase 2, so that's 65 and up, and get through our educators and our childcare providers and our first responders, we will look to open up additional appointments for those of you who live in our community but don't work in Johnson County.
And I just want to add to that is that group of educators K through 12, as well as childcare providers, is our estimate is that we have about 25,000 persons in that group. So again, a perspective, by the end of next week, after we dispense the 1,100 plus doses, we will have vaccinated over 4,600 persons in that group. It is slow. It's slow lightly because of availability of vaccine, but we're chipping away. And that's the same thing with our 65 plus group. It's the same thing with our second doses. We're making those progress. 65 plus, really important to look at that picture, not just from the clinic that the health department is offering, but that our 6 other health systems are also vaccinating in that group. Not as much as they could. They have more capacity, and the limiting factor is still vaccine, but we are chipping away. Again, when you take into consideration the number of doses that is coming into the county, it does require that we are patient. We're getting, this week we got fewer than 6,000 doses. Other weeks we're getting fewer than 7,000 doses. There's just so much you can do with that number of doses for a population, a county our size. It will require that we prioritize in some form or fashion. It will require that we continue to ask for your patience.
All right, thanks to both of you. We do have several questions coming in on our Facebook feed, so I'm just gonna go ahead and start asking some of them. And I'll start with second doses. That there are a lot of questions about second doses. I know we talked about that for a while. People are asking very specifically about dates. So if I was due on February 5th or February 12th, should I have heard? When will I hear? So I guess maybe if you talk about your clinics this week, when were those due dates for the people that are getting vaccinated, getting their second dose this week?
Elizabeth, please jump in. I think for the Moderna clinic, tomorrow, which is February 9th, it will be everyone that's due their doses up until tomorrow. Okay. For the clinic on Wednesday, it will be everyone that's due their doses up until Wednesday, the 17th, I believe. No, I'm sorry. Today's the 9th, 10th, and 11th. So we are not scheduling. We are not. If you are due your second dose on Friday or Thursday, you will not have been included in the clinic that's tomorrow. That's exclusively for second dose for those that took the Moderna vaccine. Now, again, like I was saying, we're working on trying to schedule an appointment for everyone that's due for the rest of the week. We're working on those, and we should be providing more information. I shouldn't say for everyone, for most people, because again, it's a very large number. We'll be providing more details tomorrow about additional clinics.
So if somebody had said that they were due for their second dose February 5th and have not heard from you, should they have heard by now? And if so, what should they do?
They should have had by now. Elizabeth, do you want to speak to that? Again, if you should have had by now. Now, some of those spots were taken up very quickly. There's a lot of other things that we think are going on with people booking their appointment, but there's no point kind of spending time. But if it's Pfizer, I think there's probably more people that are due in Pfizer that probably don't have an appointment than Moderna. Everyone that's due Moderna until tomorrow should have heard from us. We still have additional spaces there. Elizabeth, anything you want to add to that?
Yeah, so if you were due for your dose on the 5th and have not heard from us, did not receive an email at the end of last week for this week's appointments, feel free to reach out. And I think the best way to do that is to email us, and so that we can connect with you directly. A lot of times the problem is just an email match, and maybe it was a mistyped email, and so you maybe did not receive that, or maybe it went into your junk mail. So our email address is jcdhe@jocogov.org, and that stands for the Johnson County Department of Health and Environment. And if you email us and let us know your name, we will make sure that you get a link for those second Pfizer doses to sign up when those appointments become available. And I know that there are some questions about that 42 days that Dr. Areola keeps mentioning. Let us be clear that while you can get that dose up to 42 days, we are not asking that you do that. We are trying to get you in as close to that second date as possible. But there are a lot of moving parts, and some of it is making sure that you're not getting it before your due date and when our clinics fall during the week. So if you have to wait a few extra days, that is okay. It does not seem to affect how efficacious the vaccine is, how good of an immune response you get from the vaccine. But certainly if you are past your due date and have not heard from us, again, I'm going to ask that you reach out via email to jcdhe@jocogov.org, and we'll make sure that you get that second dose scheduled.
And thank you for that clarification. Even though CDC's recommendation is up to 42 days, that's not our target. Our target is to get you as close to your due date for second dose as possible. So thank you for clarifying that.
Great, thank you. So we're also seeing a lot of questions, I'm 65 or over with underlying health conditions. When can I be vaccinated? Or I'm 73, when can I be vaccinated? So very specific questions, people just wanting that vaccine. What is some advice? What are some steps people can take?
And we have all received several emails and phone calls along the same line. If you are 65, if you are 73, you already qualified to receive the vaccine. Let me reiterate that. If you are 65 or older, you are in phase 2, tier 1, you already qualified to receive the vaccine. The only reason why you may not have received a call from us or email or qualified to book an appointment with us or with any of our health systems is simply because we just don't have enough vaccine. I personally get a lot of emails asking the same question. So it goes back to what we're asking you to do. If you have completed the online vaccine interest survey form, that's all you need to do. If you haven't, please go to our website, jocogov.org/coronavirus, and complete that online vaccine interest form. Now we have a system in place thanks to a collaboration with our DTI group that would email you to acknowledge that you have completed that. Now, beyond that, we ask that you be patient. Right now, we chose to focus on those that are 80 plus. And that's not saying that you are not a priority, or it's just we have to find a way to distribute the very limited doses that we have. And so very soon, we will reach out to you. We'll provide information about how to book an appointment for vaccination. And we're also optimistic and hopeful that we are going to be getting more vaccine in the coming weeks. So if we suddenly start getting large doses of vaccine in the county, it just means that we are able to vaccinate more and more people every day, every week. and then we can get through that list quicker. I would say that just looking at our numbers in the county, there are over 95,000 residents over 65 years old. So that's a very, very large pool. And so we're chipping away. We are vaccinating at our clinics. Our health systems are vaccinating within that group. So every week, there are fewer and fewer persons in that group. Again, we ask you do qualify right now. There's nothing else that you need to do. I can't answer definitively when you will get it, but I know that you will get it as we get more vaccine and we hold more clinics.
I'll also, sorry, Jody.
That's okay.
I'll also jump into, absolutely following up on what Dr. Areola said, fill out our vaccine interest survey from a health department. That's how we will know that you are interested in being vaccinated. If you have the opportunity to get vaccinated through your healthcare provider, through a health system, absolutely go ahead and do that. It opens up one of our appointments for somebody who's maybe not affiliated with a healthcare system. And we're also starting to hear more about our pharmacies in Johnson County who may be getting vaccines and able to start vaccinating beginning next week. Again, not a lot of doses. We heard today that our understanding is there will be a couple of pharmacies in Johnson County who receive doses through this avenue. But again, we're talking about 8,700 doses across 32 counties in Kansas. So not a lot, but again, each one of these steps is a step in the right direction to providing vaccine through a number of different avenues to make it as available as possible to our residents. So again, much slower than we'd hoped, very limited by the number of doses we can receive, but each step, each week, I think we're getting closer and closer so that we can get everybody in this phase immunized. It's going to take us a while.
You mentioned numbers of doses. So people are wondering, how is it decided how many doses the state of Kansas gets, how many doses the Johnson County gets? How are those decisions made?
The decision on how many doses the state of Kansas gets and how many Johnson County gets, it's outside of our purview. And I don't want to, I think there are a few information that we know, but the decision on how many doses we get is made by the Kansas Department of Health and Environment. And we have no control over that. Of course, we continue to advocate for more doses. We continue to stress the fact that Johnson County represents over 20% of our population, and that we have a high concentration of healthcare workers and 65 plus and other critical workers that should be reflected in the number of vaccines that we get. But your question is, how are those decisions made? It's outside of our purview.
We have several people commenting and questioning about Advent Health. They had a clinic this past Saturday. Some people are concerned that it was a friends and family event, that it wasn't really open to their patients. What information do we have on the event that was held on Saturday?
Advent Health is one of our health systems that collected vaccine from us. The focus of this stage of vaccination is on those that are 65 plus. And we know that they have several patients or clients that have had encountered with them. And again, when you are only working through 2,000, 3,000 doses, it does feel a certain way. We feel pretty confident that based on our regular conversation with them and other health systems, that we are vaccinating in the appropriate age group. Those are 65 plus. Now, when you have very few doses, there's always a lot of questions that people raise about how the selection is made and all of those details. I can't speak to that as to that, but I do know that Advent, to be precise, is also creating a way for even people that are not their clients to signify interest in vaccination. And we're just starting. As we get more vaccines, these things become less important. I think for me, what's important is people want the vaccine, and I want you to be vaccinated. So I think we're working towards the same goal. As we get more vaccine, there'll be more opportunities for every one of us to get vaccinated.
Some people are asking if we are still vaccinating in the 80 plus group, why did we also open it up to 65 plus? What's the thought there?
Yeah, there's not a time when we have strictly stayed with one group. Our 65 plus group could be as many as 95,000 persons in bulk. Of course, some of them are vaccinated through the Federal Pharmacy Partnership Program and other means, some through the VA. And while we focus on 80 plus, we were also vaccinating law enforcement. We were also vaccinating childcare and educators. And so all of this, even including those entities that are in tier 2, tier 3, are all part of phase 2. And so we're making the best decisions that we can as we proceed. One of the reasons why we asked our health systems to focus on 65 plus is because of this. I mean, one earlier question was, I'm 65, when do I get my vaccine? So everybody wants the vaccine on a daily basis. I'm getting that question from 65-year-olds, from 71-year-olds, from 79-year-olds. Everyone does qualify, and we're trying to use multiple channels to get the vaccine to you. Yes, we are vaccinating in the 80 plus category. That's what we are focusing our first doses on this week. We are looking at additional clinics for this week, not just to finish second doses that are due this week, but also to vaccinate more, even in the 80 plus group. The very first time that we look at our data, we had just under 7,000 persons in this category, and we immediately focused on them. But since then, there's been several more that have completed the online interest form. Still remains our primary focus. But again, this is a vaccination effort is very broad. And within this 65 plus also, we are working on programs that are targeting our independent living. Again, there are multiple things that are occurring simultaneously. It's not really either or, it's this and that and that and that, and that's the way that we've got to look at this.
Thank you. Someone had a question. If they took the interest survey and then ended up being able to get a vaccination somewhere else, do they need to come back to you and tell you that so you don't have to worry about scheduling them, or what advice would you give that person?
Well, I certainly appreciate the individual or individuals wanting to follow back up to ensure that we have that accounted for appropriately. But to be honest, with the number of individuals that we have who have filled out the survey, as well as our hope to increase the availability of the vaccine throughout Johnson County, it's probably too much to ask that everybody inform us if they've gotten their dose somewhere else. So if you do receive an invitation from us for a vaccine appointment, you can just go ahead and delete that email and keep going. And congratulations on being able to get a dose. So
a couple of people have asked about volunteers, and we've talked about this before. They're saying, why aren't we using volunteers to give vaccination? Someone on this watching as an RN would love to volunteer. And I'd love to get that message out again, that we do want volunteers and how people can participate.
We do want volunteers. We are using volunteers, and we'll continue to use volunteers. Like this week, the conversation around adding additional clinics centers on our ability to use volunteers. So again, if you want to volunteer, please email us, jcdhe@jocogov.org, same email that Elizabeth put out before, and indicate that we have people that are managing our volunteer system and volunteers. And of course, we do have a vetting process. But if you are willing to volunteer, just send us an email and we'll reach out to you.
Someone wants to know, with the weather conditions not being good this week, if people decide to cancel their appointments and appointments open up, what will you do with those open slots? How will you reach out to people, or will you reach out to people who are eligible if appointments open up unexpectedly due to the weather?
I think the first thing that we want to make sure everyone is to be safe. If you don't feel safe, I mean, we had people today who did not feel like the road were okay for them to drive, and they stayed home, and that's absolutely okay with us. I think a couple of weeks ago when we vaccinated in the 80+ category and the weather was bad, we did offer the same thing, that if you are unable to make it, that's okay too. Just let us know. We'll try to reschedule you as quickly as we can. But safety first. We don't want, it's going to be especially cold this week and next week. Very important for people to dress appropriately. Our clinics move pretty fast, but still, with hundreds of people coming in, you need to be ready for the weather and to ensure that you're safe. If the road conditions are not okay, please stay home. Cancel your appointment, let us know. We'll do our best to fit you in as quickly as we can.
I will jump in here and say that if you do find that you need to either cancel your appointment or reschedule, and you have received an email from us confirming that appointment, on the right-hand side of your screen, there are some buttons for you to go ahead and do that on your own. You can either cancel your appointment or reschedule it. We would love for you to do that. That way, you know, our phone lines and our emails, we are able to address other concerns. But if you go ahead and cancel your appointment because of weather and are unable to reschedule because we don't have any open appointments, don't worry. As long as you filled out that interest survey in the first place, we'll continue to keep sending you an email for appointments when they become available. Just because you signed up and canceled does not mean you're off our list altogether. We're going back and trying to double check that list. So look at that email that you got when you confirmed your appointment, and you can click that button to cancel or reschedule. And that's the easiest way to take care of that.
Great. And then a couple of people have been asking again for the status of teachers and educators. So it could have been that people joined late, but maybe Elizabeth, if you could just go ahead and summarize in education, who has been vaccinated so far, who's being vaccinated this week, and what are the plans moving forward? And also, how will people that work in schools find out when it's their turn?
Absolutely. So for our educators, our K-12 school staff, we started with our school nurses, and that was both in public and private schools, because those are going to be individuals who have the potential to be face-to-face, potentially unmasked with a sick kid. So we started with them. And then this past week, we immunized about 3,500 staff from our public schools. And these were our SPED teachers, our special education teachers, as well as a percentage of each of our school districts that were prioritized by each school district administration. So if you have questions about where you may fall in the immunization for your school district, please reach out to your administration. They have each been tasked with identifying who needs to come first and then beyond. So whether that looks like critical infrastructure for them, if they need bus drivers and janitors and food workers to keep the school open, and then beyond that. And so that's really within the school district. So if you are an employee of one of our public or private schools in Johnson County, please reach out to your administration to find out what that looks like for you. If you are a teacher who lives in Johnson County but works outside of our community, at this time, please reach out to your school's administration and find out if there's any opportunities for vaccination through them or through the jurisdiction in which you work. Otherwise, as we complete phase 1 or phase 2, tier 1, so these 65 and up, and our K-12 educators and our childcare providers and our first responders, we will likely open up additional spots to sort of pick up anybody that we had missed in those first rounds. And so that would be a time where you would be eligible for that. But at this time, in order to streamline our vaccine clinics and the signing up process, we are working directly with our school districts and our schools.
Okay, great. Thank you so much. Thanks to both of you, and also thanks to Allison, our ASL interpreter. Just so people watching know what we do after these Facebook Lives, we go back and we look at the questions that maybe we didn't get to, and we go back and answer as many questions as we can, as quickly as we can. It does take a little bit of time, but we'll be working into the evening and tomorrow to get that done to the best of our ability. And then also, if there's some questions we've seen multiple times that maybe we didn't get to address in today's session, we will bring them up again tomorrow. So we will continue to do these. and use them as ways to educate along with our newsletter and all the other tools that we have. So thanks everybody for watching. We will be back here tomorrow, and have a good evening. Thanks so much.